I would suggest the 5 milligrams of Valium twice daily because she's manic. Perfect. Okay, I've really got to go. I've got a patient here. Perfect. Thank you. Clay, how are you doing?
Dr. White.
Hi. How have you been sleeping lately?
I don't know. I feel like I fall asleep and everything's just blank.
Blank, okay. Well, I mean, that's okay. You're falling asleep. It sounds as if you're getting a good deep sleep every night then, no? Or
I don't know. I feel like something happens. I don't know what, but I feel like something happens.
something happens, huh? Well, what's the last thing you do before you fall asleep each night?
I stare out my window.
Stare out the window. Anything in particular, or?
Just watch. I think something comes inside.
Something. Who do you think comes inside?
What?
I'm sorry?
Not who. You go, girl. Bitch looks better than me.
My 1 o'clock here yet.
I got her all set up for you, Dr. White. She's in there.
Ah, Clay! Oh, I hope my wife's dog is not bothering you. She had to leave it here.
No.
Oh, good. I'd like to talk more about last week's session, if that's okay with you.
Okay.
Now, you said that some thing comes into your room at night. Do I have that correct?
Yes.
Okay, all right. And again, how long have you been having this feeling?
I guess I always have.
Okay, always. And you do lock your doors and windows at night, is that correct?
Of course.
Okay.
I didn't have an alarm system.
See, now, if everything is locked and your alarm system isn't triggered, doesn't that mean, or doesn't that indicate that nobody's getting in?
I don't know how they do it, and I know how this sounds, but I think it happened again last night.
Okay, all right. Well, I mean, would you be willing to set up cameras to see if this theory is true, or?
I do not want to know. I don't think I'm supposed to know, and I don't think you're supposed to know.
Yeah, but if there's nothing there, isn't that worth knowing? And if we're going to expect any kind of progress, I think this is what has to happen.
Okay, but I don't want to watch it.
Well, fair enough.
I hope this works.
Okay, yeah. Well, you just continue taking that and we'll be. Yes, okay. Nice to see you. Okay. Is my 1 o'clock here yet?
No, she didn't call, didn't come.
Really? That's unlike Clay.
Oh, and did you see what she was wearing? Girl, you know those titties are fake, right? And you get my eyes out. Oh, girl, let me get you on hold. Hi, Mary. Dr. White is ready for your session. You can go on in.
Thank you.
Look. Yeah. I wish this was a pet therapy. I just want to pet kitties.
Ah, Mary, come on in. How you doing? Just going over some charts here. Okay, Mary, come on over here. Just sit down right here. There you go. Okay.
Thank you, doctor.
Oh, you're welcome. And how are you, Mary? Are you still having those bad dreams we discussed?
Yes, Dr. White.
Mary, please, Gary. Okay, so yes. Now, how are your dreams? Have you been able to sleep?
No, Doc. Gary.
Hmm.
I'm still having nightmares.
Okay. All right. Well, Mary, I've looked closer into your file, all the way back to your late teens and early 20s, and I don't want to catch you off guard here with this, but you know, it says that your brother had gone crazy and killed your entire family, including your dog. Now, I guess he would have killed you too, but the neighbors heard screaming and called the police right away, so they got there in time. Now, Mary, you told me that you lost your sight from a congenital disease, but
Yes, I did.
yeah, well, I mean, it says here that your brother stabbed your eyes out with a garden hoe. Hi, Mary.
He slit both of our parents' throats, and then he skinned our dog alive.
Well, Mary, you've been through so much that it's no wonder you have the nightmares that you have. Well, the good news, I think, though, is that now that you've started to open up about this, I believe that the healing process can actually begin now. Okay? Do you know where your brother is these days?
Yeah, they took him to the Irving Park Mental Institution. Rot.
That's correct. Were you aware of the incident that happened at the institute?
Incident?
What?
What happened?
Okay, well, now just remain calm here. But apparently there was a medical student there, and this medical student discovered some pretty horrific things that were happening to some of the patients. So this student actually helped a bunch of patients escape. What I'm trying to say here is that your brother was one of the patients that escaped.
Escaped. I mean, did they find him?
No, they have not found him. They're looking, but they have not found him yet. Okay? Do you know who I am, Mary?
Yeah, you're my therapist. You're Gary White.
Mm-hmm. Do you know who I am? Your fucking brother, Mary.
Oh,
Yeah, intermission.